It's a lingering problem that plagues many breast cancer survivors.
It's constantly there. It never goes away. You always feel like your arm is sticking out a little bit further than the other one.
For many survivors, it's a constant reminder of their battle with breast cancer.
We're talking about painful swelling that makes it difficult to do everyday things. Our Dr. Frank McGeorge here with the latest on a procedure that's already helping some patients.
Absolutely, Kimberly and Jason. So it's called lymphedema, the buildup of fluid in part of the body. It's a common side effect of cancer treatment when lymph nodes are either removed or damaged by radiation. There's technically no cure, but there is new hope.
You can't wear the wedding ring anymore.
Correct.
Okay, so that's important.
Yes, yes.
Peggy Weigert of Clinton Township is here to have her lymph nodes mapped.
It is your normal lymphatic system that go trace it up.
I went through several rounds of chemo and ended up having a mastectomy with the cancer being actually spread into my lymph node system, and they ended up removing 10 lymph nodes out of my armpit during surgery.
There's a significant backflow of your lymphatic system around your elbow.
That's causing swelling and numbness. The primary treatments are massage and compression wraps.
They taught me how to wrap my arm. Basically, it was from my fingertips up to my shoulder. You look like almost like a mummy effect, and you would typically keep that on for anywhere from 6 to 10 hours a day.
But that's not very effective for some patients.
It's probably the most neglected medical condition.
Dr. Kongkrit Chaiyasate, a plastic and reconstructive surgeon at Beaumont Hospital in Royal Oak, is determined to help change that.
In the past 20 years, we slowly developed a technique that allow us to help women with the lymphedema. So the two main techniques that we use is a lymphovenous bypass or lymph node transplant.
Lymph node transplants are performed more commonly because it's considered experimental by many insurance companies. And also,
the result is quite unpredictable. Sometimes it works great in some patient, and then we do exactly the same procedure in another patient, it doesn't work.
But when it does work, the results can be life-changing.
I had a hard time working with the kids, doing stuff around the house. Yeah, I was limited.
Sherry Boston battled chronic pain and swelling in her right arm after her mastectomy.
It was up like this. It was big, wasn't it? Yeah, it was real big. It was you couldn't control it.
After Dr. Chaiyasate suggested a lymph node transplant, her swelling was cut in half.
I feel a lot better, yeah, with it. I'm happy with it. I can play with the grandkids. I can pick them up.
The research is ongoing to figure out which methods are best and why it works for some patients and not others. It's a chance Peggy is willing to take.
It's just amazing that they're out there finding these new techniques.
When you perform this procedure, you have nothing to lose. So basically, if it doesn't work, the women go back to the same lymphedema condition. But if it works, you can significantly improve quality of life for the patients. So those patients do need help. They do need help.
Peggy had the surgery and has actually seen her swelling significantly decreased. Dr. Chaiyasate says the procedure usually does end up being approved by insurance plans for breast cancer patients, although not always for lymphedema caused by other conditions. Now, you can learn more about lymph node transplants on the health page at clickondetroit.com.
Really good. It sounds promising.
Thanks, Doc.
Here's Karen Drew with what's